and welcome to the Childhood Trauma Learning Collaborative webinar, Compassionate Leadership, Caring for Yourself and Others in Times of Crisis. We're here today with the director of the School Mental Health Initiative, Dr. Martha Staley. And I'd like to acknowledge the traditional, ancestral, unceded territory of the Wappinger Nation, now known as the Greater New Haven, Connecticut area, where Martha and I are joining from. My name is Dana Asby, and I will be your webinar manager and host. Our funding comes from the Substance Abuse and Mental Health Services Administration. The views and opinions expressed in today's webinar are those of the presenters, not SAMHSA. The Mental Health Technology Transfer Center Network uses person-centered, affirming, respectful, and recovery-oriented language in all activities. During this webinar, please ensure that whenever you are contributing to our discussion via the chat or during the question and answer session of our time together, that you use language that is strengths-based, healing, and trauma responsive. Just a little housekeeping, microphones will be muted during the presentation. And then during our question and answer session, you can use the raise your hand feature to request an open mic. When you are speaking, be sure to eliminate background noise. You can also submit questions for Martha throughout the presentation using the chat. Registration does affirm your consent to receive an evaluation follow-up link via email and your consent to recording. If you experience any technical issues today, please send a private chat to Ingrid Paget, our technical support manager for today's webinar. We're pleased that you joined our webinar, and I'd now like to introduce Dr. Martha Staley, who is a faculty member at the Program for Recovery and Community Health in the Yale School of Medicine, Department of Psychiatry. She's also the director of the School Mental Health Initiative for the New England Mental Health Technology Transfer Center, and she's trained as a secondary English teacher with a PhD in public health. Martha has extensive experience in population health and epidemiology, qualitative and mixed methods research design, analysis, and evaluation, as well as community and clinical intervention implementation. Martha, I'd love to turn it over to you.
Hi, everyone. It's so wonderful to be with you all. Welcome to this webinar on compassionate leadership. I'm really pleased to be with you today to talk about this subject, which is near and dear to my heart and something that I am always working on along with all of you. So I just want to go over the things that we'll be talking about today in this session. The first thing is we'll be talking about leadership during challenging times. So in this sort of post-COVID or in the middle of the COVID still during the pandemic, what it's like to be a leader and some of the challenges that leaders face. We're going to be talking about the multiple demands and conflicting roles that leaders bring to their work, particularly now. I'm going to be going over 10 key practices to support compassionate leadership in your work, as well as key questions for compassionate leaders at decision points when you're struggling to make a decision. Then we will have some time for questions. And wrap up with Dana telling us more about some of our additional resources within the New England MHTTC. So I want to begin with a very brief mindfulness exercise, which is printed on the screen. Some of you might not realize that this is a mindfulness practice, but it is a passage that I think about a lot. I even have it on a bracelet, so it's near and dear to my heart. So if we can just take a moment to arrive here together and to take a deep breath, find a comfortable place to sit, and close your eyes if you feel comfortable doing that. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And this is something that I say to myself a lot as a leader. I will say that I also use it a lot as a parent, as a person in the world, as a member of a 12-step group. And so I hope that this is helpful for you as we begin our time together. So the first thing I want to do is talk about work and leadership during challenging times. And this quote is from one of the people that we work with here at the New England MHTTC and the Childhood Trauma Learning Collaborative. We're suffering, which I think speaks to a lot of us over these last 2 years, and maybe before. But let's begin by setting the stage of what leaders are coping with. And I chose an image of a tightrope walker, right? Because as leaders, we are always trying to walk a thin line, right, of balancing all of the different things. And I want to be really clear that when I'm talking about leaders, you may lead an organization or a system, a department, or a team. You may be leading a classroom, or a family, and you may be aspiring to leadership or wanting to be more mindful about your leadership skills. And I want you to know that all of this is for you, and that I'm talking to you regardless of how we are defining leaders right now. So we know that leadership is hard work, and it's hard work, especially now. And there are a lot of statistics that I could talk about how much workers are suffering right now. We know that about 90% of the workforce in the United States is feeling burned out or considering leaving their jobs, rethinking their work lives. But we know that 60% of leaders report that they feel used up at the end of the workday. And actually, I'm surprised that that's not higher. I expect that we'll see that number go up. Um, Approximately 44% of those leaders who feel used up are looking to leave their current job, and a quarter of them are expected to leave within the next year. Only 20% of leaders believe that they were effective at leading virtually. And about 60% of leaders report their workplaces are trying to address employee stress or leaders' stress, but 30% wish that their organizations were more empathetic to the stresses that leaders are feeling at all levels right now. So we know that the workforce is suffering, and we as leaders are also part of that suffering, particularly when we are in caregiving roles or in passion-driven workplaces like schools, like community health. Um, Next slide. And we know that COVID-19 and all of the factors around the pandemic made a tough job even more difficult, that many of us are struggling with mental health in ourselves, in our workers or our teams. Um, Most workers have experienced stress, and half of our workforce experienced exhaustion, overwhelm, frustration, depression. We know that often in the work that we're doing in school mental health or in mental health, um, we are exposed to vicarious trauma, and are really at the front lines often for people who are in distress. We're also, balancing all of that with family life, and we're worried about our family's health, and our children and our parents and the people that we care for. Many people are not feeling supported at work, and organizational factors have made things more difficult. And that includes workers feeling like they are treated unfairly, have an unmanageable workload, aren't clear on the roles within their workplaces, lack of communication support, and unreasonable pressure. And I think many of us can relate to that in our workplaces, the amount of pressure that we're under to do multiple things at once. Um, and we know that COVID-19 really shone a new light on inequity. We know that while workers are suffering, these effects are disproportionate among women, people who are members of BIPOC communities, and people who have a socioeconomic status of middle or lower income. So these stresses are not always equitable. I just briefly want to review some of the signs of burnout, because really what we're talking about is leadership when you yourself are facing burnout and when you have a team at work, or you're leading a team that is struggling with exhaustion and burnout. And it can be signs like impatience and irritation, low energy, exhaustion, apathy and compassion fatigue, limited concentration, physical symptoms changes, sleep changes, sadness, use of substances or addiction, isolation and loneliness, getting sick or feeling run down, skipping work or being late, and anger. We know those are all signs that there's something amiss in yourself or your work life when you're beginning to feel these signs. And many of us throughout the last 2 years have experienced some of these signs and are becoming more aware of our own levels of exhaustion. And we know that it's really important to think about what burnout, exhaustion, trauma looks like for you first. Think about what your particular signs are that you are feeling exhausted or too stressed. Next slide. And there are a lot of consequences of workplace burnout, stress, and trauma if it's ignored and unaddressed. I'm not going to read all of them, don't worry, but take a look at these. It affects not only us as individuals. We have a tendency to think of exhaustion as being an individual problem. And it certainly is an issue that we have to address as individuals, but it also affects our overall health and our work in our workplace, including our colleagues and those that we're serving, whether that's clients or students. So we're going to move into what the particular challenges for leaders are in the workplace, the multiple roles, demands, and needs. And the fact that leaders are saying that they feel that there is just no time to rest. And I certainly know many of you have put in longer hours with fewer breaks over the last 2 years. So leaders and workers are bringing to their work, particularly in these passion-driven workplaces, which are things like schools and healthcare, multiple identities and multiple roles, right? So we're all balancing multiple things, our own experience of what's going on, our culture and communities, um, our home and family life and stresses and challenges, our own biases, our values and deeply held beliefs, our personal attributes and characteristics, personal history, our own role within our organization and work, our own experience of trauma on the job or in our lives, our preferences, our training and education, and then all of these other factors that surround our multiple identities and roles at work, including the field, society, stigma, colleagues, patients, clients, students. So I point this out. It's obvious that we bring these things into our lives, but it's even more obvious now. And it's worth taking a moment to think about all of the parts of ourself that we are bringing into our work, and how all of those parts influence how we see our workplaces and how we lead. But that our workers, our teams, are also bringing all of these pieces of themselves into their work. And it's important to think about leadership and all of these things taking place within a broader context. So we have leaders here in the middle, but we are surrounded by individual wellness factors, our organizational and systems culture, our cultural values and practices, and societal and community challenges and needs. And I bring this up because it's important to think about some of the issues that we're struggling with, again, not as individual issues, but issues that occur within a larger context. So while we may be leaders in particular segments of our work, we're all working within these additional contexts. And so it's important to think of our work and think of our leadership practices as occurring within that context. And that's something that leaders have to be particularly mindful of, these different factors that are affecting our work and our staff and ourselves. We know that in the last couple of years, there are many systemic and workplace challenges for leaders to contend with, underlying personal factors, when our systems are broken, our trauma duration and intensity. Many of us have been exposed to trauma now for a long period of time, and often very intense trauma. our own helplessness and uncertainty about what will happen next and what the future looks like. And issues of capacity when the needs on our systems and our work overwhelm our resources, whether that's time, energy, personnel, budgetary resources. And all of these things combine together to cause and influence our stress, trauma, and burnout. Um, so next slide. These factors can cause us to lose our compassion, lose our ability to relate compassionately to our colleagues and our staff. It can lead to anxiety, so fears about the future, safety, well-being, um, uncertainty, exhaustion, depression and fatigue, not enjoying anything, being unable to do things outside of work at the end of the day, um, grief, our sadness about the things that we have all lost, whether that's individually or as a community or within your workplace. Anger at the loss of control, anger at injustice and disparity, frustration with the actions or inaction of others, and guilt. That's something that we often don't talk about in leadership, but having survived something, having compassion for the others who haven't survived or who are no longer working with us, guilt about not being able to do more or not coping well or not doing enough, all of that guilt and shame that can arise when we are too stressed, too burned out, and too traumatized. In this context, the things that are our strengths that we bring into our work that make us good leaders and thoughtful leaders can also become liabilities and sort of run amok when we are feeling fatigued and burned out and stressed. So our desire to be perfectionism, which is our desire for perfectionism, which is a strength, valuing excellence, can also be changed over time to feeling like nothing is ever good enough and the standards are impossible, um, or being ashamed when we make mistakes. Our toughness, our ability to stick with something and to lead and to come back to our work day after day, our ability to persevere through difficult circumstances can also make it difficult to ask for help or admit when we are struggling. And if we're not careful, that can lead to compassion fatigue. Our desire to serve our staff or our community or our students, putting others before ourselves, the things that make us successful and be called to do the work that we're doing, can also sometimes, if we're not careful, lead to us ignoring our own needs and working hard to be good to our own detriment or cost. Our loyalty to our mission and to our organizations, to the people that we serve, our commitment, which is a wonderful characteristic, can also lead us to feeling anonymous or voiceless or um, prioritizing the mission over the people. We got to get this done because this is part of our mission. And our integrity, our strong moral code, our abilities, and our commitment to understanding right versus wrong can lead to some black and white thinking and being rigid about rules and the way things should be done, and then lead also to guilt if things are imperfect or if we're in a gray area. And I'm talking about all of these things because these factors that are surrounding us and within us can get in the way of our compassionate leadership. Um, so what gets in the way of compassionate leadership? Feeling like there's too much to do, I don't have enough support, or too much budget, time, energy. I'm too busy or tired. I can't deal with this compassionately. I'm too exhausted. That other people need me more. I have to help them first. That's my priority, and ignoring our own needs. I'll do it later when I have more time or energy or after my vacation or when I have more help. Um, Feeling like I just don't care anymore. I don't care what happens. I'm exhausted. It's hard to be compassionate when you're feeling like you don't care. Um, Feeling like the need is too great, your staff's need, your classroom's need, the needs of your students or your clients. Not knowing how to be a compassionate leader, not knowing how to come back to the parts of yourself that are invested and committed to the work that you're doing. Feeling like being compassionate is so impractical, it's self-indulgent, it's not really part of our mission, it's not valued by the higher ups. So dismissing that as being sort of indulgent. What are we really saying through these factors that we're thinking through? What we're saying with these phrases above is that we are less important than the people we care for. We're saying I or we don't really matter that much. We're saying we are not worth caring for. Let's say it again. When we do these things, we are saying we are not worth caring for. So how do we then take these things and thinking about the factors that we're struggling with and the issues, challenges that are arising in our workplace, thinking about our reasons to disconnect from the compassionate and connected parts of ourselves? How do we then cultivate within ourselves and within our workplaces, leading with compassion, cultivating resilience, healing yourself and others? And I want to bring your attention to this model of compassionate school mental health that we talk a lot about in the New England MHTTC and in our work with the Childhood Trauma Learning Collaborative. And this is a model for compassionate school mental health that really sees youth at the center of what we're doing from 4 different perspectives: preventing and reducing the causes of mental health challenges, supporting youth, building resiliency, and developing protective factors. And I bring this up even though we are not talking specifically about youth in this context, as a way of thinking about how we can expand this model to put youth in our center, in the center of our work, but also ourselves and our people. Um, so what I'm talking about today has a really robust evidence base. It also has a robust experience base, but it's all informed by this model of thinking about people as whole people and a really person-centered and resilience-oriented approach. So let's think a little bit about, we've talked about some of the challenges that leaders are currently experiencing, but let's think a little bit about what compassionate leaders are, what compassionate leaders do. Compassionate leaders are always learning. We're always trying to grow, to learn, to be flexible. Compassionate leaders place well-being at the center for themselves, for their teams, the well-being of their teams at the center of their work and their approach. Compassionate leaders are trauma conscious and mindful. Compassionate leaders care for themselves first because we know, like the old saying about the oxygen mask on the airplane, when you hit turbulence, it comes down, you need to put your oxygen mask on first before you affix the mask to the people around you. Compassionate leaders must start by caring for themselves. Compassionate leaders know that their team, the people around them, their colleagues, are the greatest asset to their work and really precious and worth caring about. Compassionate leaders see themselves and their team as people first. So understanding their personhood, understanding the multiple identities and roles that I show you that people are bringing into their work. People with lives outside of work, challenges that we can't imagine, and struggles, and also strengths and resilience. Compassionate leaders prioritize equity. This is something that is really central to all of our work and that I can't emphasize enough, that Compassionate leaders see equity as a key piece of their leadership approach. Uh, Compassionate leaders honor the organization and their team vision and values. They work in collaboration with their team. So it's not an us versus them mentality, but a collaborative, team-based approach where people are working together towards a common goal and towards a common sense of wellness within their workplaces. And leaders address issues directly and transparently. So compassionate leaders are identifying issues as they come up, addressing them directly and with compassion, but making their processes transparent so that there are no surprises about reactions. And this one I think is really important and something that we don't talk enough about when we're talking about leaders is that leaders are accountable. The buck stops with them. Wherever you are in your level of leadership, um, compassionate leaders apologize when they've made a mistake. They're not afraid to apologize. And then they make changes based on what they've learned. So they're flexible. And I want to be very clear at this point that these are the things that we are aspiring to. So if these concepts are new to you, if you're struggling with some of them, join the club. You are in such good company. And I'll just say from my own experience, um, you know, compassionate leadership is a learning process and it takes a lot of starts and stops and reviewing and going back and making changes. And it's something that we all are, including myself, constantly working on to try to reapproach our work with a fresh perspective towards compassion. So there are some principles to keep in mind as we're talking about compassionate leadership. Um, Collaborative leadership. You may set the tone for your team, but you cannot do it alone. So it's important to enlist help and guidance from your team and your leadership, whoever that might be. Equity and privilege. So suffering and trauma within our workplaces are not distributed equally. The ability to make choices about workplace well-being or health is a privilege that not everybody has. It's really important for us to keep in mind, and as I'm discussing leadership, to understand that leaders are one piece of this whole equation, but that the organizational influence is profoundly important. So personal well-being, self-care practices, your own practice of compassionate leadership can't make up for a toxic work environment or a broken system. Um, I have linked a bunch of resources throughout the rest of the presentation that will be available when you get the slides. Um, but burnout is systemic and organizational. It's a workplace issue. And the object of self-care and caring for yourself as a leader is not to make yourself more productive at work. It's to care for yourself. That's the object of self-care. To understand that you are an important and valuable member of the team, but that self-care practices, taking care of yourself, even taking care of individual team members, can't outweigh the organizational influence. It's important to understand that culture counts. So if you're in a position of leadership, you can make concepts of compassion, trauma consciousness explicitly valued and modeled, and ensure that they are enacted in your own work and among your team to the degree that you're able. And that's important because that's our responsibility as leaders, but it's also important um, as a way of advocating for the people within your work who have less power than you do. There are diverse perspectives on all of these elements. Trauma and burnout, exhaustion are individual experiences. We all process trauma and exhaustion and burnout in different ways. So well-being and self-care look different for everyone. But regardless of that, we all have the capacity to extend love and care to ourselves and to others, regardless of the circumstances. And priorities. So you have a right and an obligation to prioritize your personal well-being. You don't have to earn it. As I said before, you don't get to take care of yourself because you've met some sort of benchmarks or produced some deliverables or met a success. It is your right to prioritize your personal well-being as a leader and as a person. And that's a message that we come back to a lot within the Childhood Trauma Learning Collaborative. So now we're going to move into some of the key compassionate practices for leaders. And we're going to go over each one of these one by one, but I want to be really clear here that this list is not exhaustive. These are not all the the compassionate practices for leaders. Just follow these 10 steps and you will be a compassionate leader. These are practices that we offer to you as the practices that we have found helpful, that we know from the evidence and from people's experience, are useful in bringing themselves back to their compassionate selves and leading their teams more effectively. But again, it's not a prescription. So I urge you, as we go through this next part of the presentation, to take what you like of these and leave the rest, and to know that whether you're working on one of these or all of these or just have them in the back of your mind, you are engaged in compassionate leadership. I also want to be really clear that as we go through these, that I'm going to be talking about a mix of organizational well-being and caring for yourself and caring for your team. And I want to be really explicit about how we believe and we know from the literature that being a compassionate leader starts with your own sense of yourself as a leader, your own mission and values for your leadership, and that it is a ripple effect, that once you are doing it for yourself, you're more able to do it for your team. It's really hard to enact these things with your team if you're not also doing them for yourself. So we urge you to think about these practices in terms of your own perspective, how you might be able to bring them into your own life, and then how you might also be able to facilitate and foster an environment that supports these practices. So the first thing is know thyself. That's the Greek for know thyself etched on that window. And also get to know your team. It's hard to be compassionate if you don't know yourself and you don't know who's on your team. And I mean get to know yourself and your team beyond just knowing what, yes, Lisa, the slides will be shared after the presentation with all of the links. Get to know yourself and the members of your team as people beyond your work. I talked about the identities that we're bringing into our work. It's important to have a deeper understanding of who's on your team and what they are bringing with them. So understand your own and your team's history. Consider the cultures that your team is bringing into the workplace. Where are they coming from? What kind of cultures are they bringing with them? Recognize the triggers and warning signs. So understand the warning signs for burnout, but understand also in yourself and your team of what particular elements of your work trigger somebody's stress response or trigger anxiety or make your work more difficult. And identify supports, the supports that are within your team, the supports that your team has beyond your work, your own supports. Focus on strengths. So take a strengths perspective with yourself and your team. What are people good at? What strengths and what resilience do they bring to their work? And find what rejuvenates and enlivens you and your team. So approach that with a spirit of curiosity about who your team members are, what makes them come alive. Just take notice of when people are curious, when they are wanting to work on a particular project, when their eyes light up, and know what rejuvenates them, whether it's quiet time or scheduling meetings at a particular point or having time off. Understand what is rejuvenating you and your team. The next concept is basic, right? But as leaders doing the work that we do, we owe it to ourselves to treat ourselves like Olympic athletes. And that means establishing norms for yourself and your team that start with health and well-being. So attending to the first things first. Um, Getting back to the basics about what is needed in your team. How are people functioning? Do they have time to eat? Do they have time to rest? Those are factors we don't necessarily think about, but it's really important for us to make sure that the basics are covered. That means attending to all the domains of wellness, and I've linked to SAMHSA's 8 domains of wellness, and the ways that people can express their well-being, and domains of wellness that you might not have yet considered. Pay attention to Halt, whether you yourself are hungry, angry, lonely, or tired, but also know that that might be a factor for members on your team. If somebody is having trouble or a struggle, think about this HALT acronym, which I find really, really helpful. Like, are the basics covered? um, Caring for yourself, making opportunities in your workplace to prioritize food, sleep, movement, even though these are not necessarily things that we think of as elements that occur within the workplace. They certainly influence um, our all of our ability to function in our work, and being conscientious about health. So making room for doctor's appointments, for prevention, for the health and medical needs that you or your team might have, and paying attention to that is really important. It's also really important to rethink your work. So thinking about the policies and procedures that you and your team work, the structures that are within your workplace, and whether those things are actually supporting or inhibiting a compassionate approach. This is a revision of an old model of workplace stress that you might have seen, which sort of indicates that there are 4 domains in a workplace that lead to workers feeling satisfied and healthy at work. Um, Workers, our team members, ourselves, we need to have elements of control over our job. We need to have choice rather than being told what to do all the time. We know that people at work need support from their colleagues, and they need support from their supervisor, um, and that these things are going to help people have increased psychological well-being at work and beyond. But that those are the factors of whether people are challenged and satisfied at work, whether they have the time and support to do what needs to be done and to attend to their own well-being. So it's important to make sure that our workplace practices and policies are reflecting our desire to be compassionate leaders. It's also really important to talk about and work on healing trauma. And we talk a lot about this in our work about trauma consciousness and trauma informed practices. And I've linked to a terrific article about trauma conscious leadership practices and things that you can do with your teams to promote a trauma conscious perspective in your workplace. Um, but many of us have experienced trauma in our workplaces, particularly over the last 2 years, but perhaps for years before that. And it's important to find outlets and ways to process that trauma, whether it's by talking about it, facing it together, whether you need to have some programming related to processing a particular trauma or incident, um, to treat each other with care, treat yourself and your team as you would a cherished loved one. So to understand that people are bringing to work trauma that you may not imagine. You may know about some of the trauma at work, but we all deserve space to begin to heal from that trauma and to acknowledge that others might be struggling with traumas. And it takes a lot of patience. Healing from trauma takes a lot of time and a lot of work. Many of us have been working on it for many years. I am somebody with a history of childhood trauma, and it takes years to process that and to come to a healing place. So it requires a lot of patience. And it's important to know when to ask for help when you need it, understanding that you're not alone, that there are resources available for you to learn more about trauma consciousness and to support a trauma-informed workplace. We have to think about our stress and meet our stress with some mindfulness about how we can reduce and treat our own stress. So it starts with you addressing your own stress as a leader and then providing space and modeling for your team to address theirs. And that's going to be individual, but is really important. You can build time and practices into your workplace and space where you can, to let people release their trauma, their stress, and to build better habits to manage stress, and to really identify the source of stress and to address that when that's possible. So that starts with looking at how you and your team are spending your time and rebalance that time and those schedules when you need to, and that requires some flexibility. Um, Building in time and space for exercise or movement, which again isn't necessarily something that we think a lot about, but giving time to people, for people to walk around, to stretch, to move, um, to go on walks together if you're in a workplace where you are working with other people and not at home. Getting outside. my my approach to my own stress is always to go outside. That's the approach that works best for my kids. It works the best for me, is get outside, get some fresh air, and find ways to laugh and play, like this darling kid with the bubbles. Laughter and play is absolutely underrated within our workplaces. It's really an important piece of connecting with other people and releasing stress. Um, Spending time and connecting with people, pets, putting down screens and getting out from behind this Zoom screen when you can. Build in hobby time and fun into your own life outside of work, but other elements of fun, or inviting people to bring in their hobbies or share more about their hobbies outside of work within your workplace. And one way that we can combat stress is by learning something new or doing something new. So switching it up, taking a different approach, doing something different, learning something new, taking different responsibilities and trading them around. So that novelty is important, but that stretching our brains and learning something new is also one of those stress relievers that you might not automatically think of, but can be a really key factor in reducing workplace stress. And we also have to think about self-care and mindfulness practices for ourselves. Self-care is necessary, and I said earlier that um, there's no amount of self-care that can undo a toxic work environment, but that doesn't make self-care any less essential. And you can incorporate mindfulness practices into your own day, within your teams or classroom, and that can be through breath work, through meditation, yoga, movement, building mindful habits, resting and disconnecting, building rituals and routines into your day to help you achieve and maintain a rhythm in your life. And all of these things don't take a lot of time, they don't take a lot of training. If you are new to mindfulness practices, we have a lot of resources, some of which I've linked here, to help you get started in small and large ways for yourself and within your teams. The next key practice or principle is about acknowledging and honoring grief. Um, Many of us are struggling with grief in our personal lives, our professional lives. We have some collective grief as a group to work through. We've talked a little bit about trauma and the fact that many of us are exposed to a high level of trauma, and that takes a toll. And it's important to acknowledge that we are sad and suffering, and sometimes grief stricken, and that grief is unpredictable and unique. It shows up in different ways throughout our lives, sometimes unexpected or unwanted. Consider rituals or ceremonies or celebrations that incorporate and honor grief. Ask for support from others, and allow yourself and your team to seek and find comfort around grief, particularly if you are grieving as a group, whether you've lost somebody in your workplace, or you've lost a student, or you have lost opportunity and time together. Also wait to make big decisions. Um, if you're grieving, it's difficult to make those kinds of big decisions, and it's okay to delay a decision in order to acknowledge grief. And then understand the difference between grief and depression, and have an understanding of where to go for help if your grief or your team's grief becomes depression. It's important to cultivate connection for yourself and others. We can't do this work alone. We can't do our work alone, but we also can't prevent burnout and promote resilience alone. So it's important to identify and access your network, to reach out to others who are suffering, to get professional help when you need it. And when you're able, if it's safe to do so, if you're in a position to do so, to model self-care and well-being and make it transparent. Set boundaries and identify your needs. Those things are also important pieces of acknowledging your own humanness and building compassion into your leadership. And you can also build a shared knowledge base and connect with members of your team by including um, programming or professional development on trauma or well-being, equity, stress reducing strategies. Those are all important ways having those shared experiences together. I mentioned a little bit about choice and control in the work environment, but this is really important for us to think about as leaders, because trauma and stress can make people feel like they've lost control or their sense of agency, we call it in psychology. So reintroducing strategies to regain control can help people feel better, promote resilience, and help people heal within a workplace environment. And that means finding people who believe in you and your team, addressing triggers, understanding your team's triggers, identifying strengths, and finding ways to offer choice and control to your team members when you can, but also having a sense of the future, working with your team to create a future for yourself, something to look forward to. As compassionate leaders, we have to focus on our team strengths. So cultivating a strengths-based approach and growth mindset. So making time for gratitude, expressing to people your gratitude that they're doing the work that they are and that they're bringing their whole selves to work. Um, Honor and seeking out joy and pleasure and play. Noticing what you've accomplished, celebrating those accomplishments, speaking with love and compassion to yourself and to others, and giving people the benefit of the doubt. So playing to their strengths and acknowledging that you are grateful for them and giving them the benefit of the doubt when you can. This is a really important piece. So rest and then reject the idea of doing more. I talked a little bit about guilt, but make the need for rest, rejuvenation, and limits explicit. So know when to say no, I'm not doing that, or we can't do that, or no more. Set boundaries for yourself and your team. So honor time off, provide safe and equitable structures for work. Reject the idea that doing more work is going to be more or more productive. Cultivate a culture that honors a break as not only okay, but that understanding that breaks are imperative and expected, and build that time into your timelines, to your structures, and to think about how we as leaders have choices, particularly as leaders. So we don't have to do things that aren't working. We can give ourselves permission to choose ourselves and our own life. That's okay. If you're in a position of leadership and you're struggling with it, it's okay to say that that's not working for you, and to do something different. And it's okay to communicate that to your team as well, to give them permission to have choice, and to say no. So I believe in the power of a no. We hear a lot about saying yes, and many of us say yes all over the place, but no is equally important, and it's imperative that we practice saying no when we when we need to and want to. So as we think about these practices, I told you how these strengths can become liabilities. Building these practices into our lives and into our leadership perspective can help these strengths that have sometimes become liabilities because of exhaustion or burnout to strengths again. So going from all these liabilities, nothing's enough, it's difficult to ask for help, ignoring our needs, feeling voiceless, this rigidity and black and white thinking can become our strengths again when we're caring for ourselves and our teams compassionately. So understanding that we are imperfect just like everyone, that you know that you have survived trials and that you can survive this and thrive, that you serve because you care for yourself first, and that allows you to also care for others, that you can cultivate a sense of loyalty, dedication to your team and their well-being, um, working together for a common good, and our sense of integrity. So being honest about our own needs, speaking up for others, being a role model. All of those are important strengths that we can come back to again when we're integrating practices to support our compassionate leadership. I want to finish up this part with some key questions for leaders when we're facing decisions that are difficult. A lot of the practices that I've talked about are preventive medicine. So you can cultivate connections and trauma consciousness, and that can prevent some challenges in our workplace. And it can also help us manage some of the challenges at our workplace. But we are presented as leaders sometimes with questions we don't know the answer to. And challenges that we're not sure how to overcome. So I wanted to just very quickly go through some of the key questions that compassionate leaders can ask themselves when trying to make a decision. And you can apply these questions to your leadership or to parenting or to any other decision points in your life as well. The first is understanding what's within your control and what isn't. So getting back to the serenity prayer that we did in the beginning, understand what you have control of and what you have to let go of because you don't have control. Asking yourself, am I willing to make a change, whether large or small? Am I willing to be flexible? Am I willing to make a change at this point? Am I focusing on solution and strengths, or am I focused on problems and barriers? Is this something I need help with? Do I need additional support, more information to bring in the leadership above me to help me with this challenge? Does this honor my own values and my boundaries? Does this honor the values of my team and their boundaries? Does this foster connection between me and my team or within my team? Or does it sever the connection? So prioritizing connection to your team is one way of determining whether something might be between two different courses. Questioning, is this equitable? Is this fair? Is this fair for everyone? Does everybody have equal opportunity? Does everybody have equal access? Is what I'm thinking about doing, is what I'm doing compassionate to myself? Is it compassionate to others? So developing the reflex to ask the question, is this a compassionate response, or do I need to take a moment and rethink this? And the last one, is this aligned with our mission and vision? So that might be your own personal mission and vision, or it may be the vision and mission of your team or your organization. But is what you're deciding on, is that aligned with that vision and coming back to basics? Final thoughts. Um, a compassionate and trauma conscious approach to leadership can help us all establish healthy and productive teams and prevent challenges and guide our navigation. Depending on your workplace, some of these principles might be easier to enact than others. That's okay. Compassionate leadership doesn't have to be overwhelming. You can use these principles that work for you when they work for you, and be compassionate with yourself in your learning and your own development. Um, and that these principles can offer an opportunity for reflection about your leadership and help you begin discussions with your teams and co-creating a vision for your team. And just a reminder that patience and a growth mindset are really important in any of these practices. And we want to extend that and teach that within our teams, but it's also important to extend that to ourselves. So I know that we are running a little bit late. I want to leave you with this quote from Maya Angelou: as soon as healing takes place, go out and heal somebody else. So focus on your healing and then go out and heal somebody else. We have limited time for questions. I'm going to ask Dana to share some additional resources with us. If you want to stay on and ask questions, I will be available, but please don't feel like you need to. If you want to contact us at any point with questions, please do so. So Dana?
Thank you so much, Martha. I would love to share with you all some of our C-TLC resources. We'll be publishing our next edition of our newsletter today. That's the Compassion Action newsletter. So a link to subscribe to that will be included in the slideshow on this slide. We also just published an online course called Cultivating Compassionate School Communities that respond to trauma effectively. And we will be talking about how to utilize that course as a state, district, or school leader with your staff next Thursday at 10 a.m. So please do join us for that session if you're able to. And we have a virtual training library that has these are three topics, many more that we have on that library. So you can use this to do professional development with the members of school staff in your community. There's a link to that library in the slideshow as well. We also have a resource directory that compiles some blogs and newsletter articles, webinars, toolkits, and other training materials on various school mental health topics. So you can find a link to that resource directory here as well. Finally, we are a part of a larger national network. There are 10 regional centers throughout the US, as well as 2 national centers for Indigenous folks and Latinx and Hispanic folks. And these are 2 of the resources that our national network has developed for school mental health. There's the National School Mental Health Best Practice Guides. We have an 8-part learning series to take you through that. And when you click on this link, it'll take you to a web page that has all of the information that your state, district, or school would need to build a comprehensive school mental health system. We also just released the Classroom Wise online course. It's a very brief course meant for educators who don't have a lot of background in mental health, to provide them with some mental health literacy strategies to implement in the classroom. There are strategies for elementary and secondary in that. We are a reminder that our funding does come from the Substance Abuse and Mental Health Services Administration, which requires us to evaluate our services. Our technical support manager, Ingrid, has just put the link to a very brief evaluation survey in the chat. It's just 3 questions. You can also use your phone to scan the QR code on the screen. So please do fill that out. It gives us really useful feedback. And attendees providing their email address will receive this survey 24 hours after the close of today's event, along with today's slide presentation. This follow-up email will also include links to request any participation certificate. We really do appreciate your honest, anonymous feedback, which provides information to SAMHSA and assists us in planning future meetings and programs. For more information about certificates, you can contact the New England Mental Health Technology Transfer Center at newengland@mhttcnetwork.org. And please also stay posted to our website, which is listed here. It's not listed there, but we will include a link to our website where you can see links to this video presentation and related slides, as well as other presentations that we have done. And don't forget to subscribe to our newsletter for more resources. So thank you all so much for being here. Please contact us with any other questions. As Martha said, there's our website. And if you'd like to stay on and have any questions, now would be the time.
Thank you, everyone, for being here. Take care of yourselves and each other. And if you'd like to stay for questions, please do.